I'm Dr. Ramshekhar Menon, professor in the Department of Neurology, Sri Chitratrinal Institute for Medical Sciences and Technology. I work with persons with various chronic neurological conditions, particularly epilepsy and dementia, as well as in pediatric neurology. And on this occasion of World Occupational Therapist Day, one cannot but overemphasize the role of occupational therapists when it comes to the management of persons with these chronic neurological conditions. As you are aware, the process of rehabilitation of persons with these conditions across various age groups, particularly persons who have undergone serious injury, whether it is traumatic brain injury, strokes, whether it is chronic epilepsy, or whether it is a degenerative process such as a neurodegenerative dementia or an ataxia, or that is a disorder of balance, or persons who have had autoimmune neurological conditions which have left and are left with debilitating sequelae. It is important that the occupational therapist be involved because these illnesses often tend to take a prolonged course and often leave neurological sequelae. This can significantly impair the cognitive health of the individual and secondarily lead to various mental illnesses because these persons may not be able to contribute to society as well as to their family life in the way that they were able to do previously. So we know very well that an occupational therapist's role comes to rehabilitation of these persons and to ensure that these persons are maximally independent when it comes to their day-to-day life and activities of daily living as well as functioning. And based on personal experience with my interactions with our occupational therapists here, as well as by seeing the work done across centers, I can vouch for the fact that the occupational therapy sessions primarily focus on the patient's activities, diverse kinds of activities, with the aim of helping them to achieve their health goals so as to retain a normal state of independence, ensure productivity both in their family as well as societal life, and also ensure a degree of mental satisfaction on having achieved these goals. So this complete process facilitates the patient to possess that sense of increased purpose, competence, as well as to ensure autonomy and ultimately, make sure that they have this wholesome feeling when it comes to having achieved a meaningful level of contribution back to society as well as to the family in the manner in which they want to achieve. And I think the role of the occupational therapist starts not only at the time point of admission or as initial assessment in outpatient clinics, but it is a continued process, much more than that of the treating physician who is primarily involved in dispensing the primary care with regard to medication.